Hello, everyone. My name is Dr. Paulo Amaral. I'm a clinical fellow on GU Oncology at Vandebilt University Medical Center. And I'm here presenting our data with the use of belzutifan in VHL patients. So VHL is a rare disease characterized by multiple neoplasms, including CNS hemangioblastomas, pancreatic lesions, and renal cell carcinoma. And as you know, belzutifan is a HIF-2 alpha inhibitor that was FDA approved after the results of LIGHT-SPARKLE 4. So LIGHT-SPARKLE 4 showed great response rates, strong disease control, reducing the need for surgical interventions on these patients. However, there is a lack of real-world evidence with the use of this drug in VHL patients. So we explored retrospectively 25 patients with a median follow-up of 34 months. The median age was 40 years old, and the most prevalent tumors were CNS hemangioblastomas in 80%, renal cell carcinoma in 72% of patients, and pancreatic neuroendocrine tumors in 40% of patients. All patients start belzutifan at 120 milligrams, which is the standard dose. And what we notice is that treatment discontinuation occurred in 24% of patients, which is 6, but only 2 patients actually discontinued the drug due to toxicities. So our finding goes along with LIGHT-SPARKLE 4 that it's a well-tolerated drug. On the other hand, we notice that 80% of patients needed treatment interruption and 30% of patients had long interruptions. And that's why, although it's a tolerated long-term, side effects are very common. And I want to highlight the most common: fatigue, anemia, nausea, dizziness, and headache. So all these side effects, they can impact patients who are taking this drug likely for many years. So we explored the impact of dose reduction in these patients, and we could capture the hemoglobin data since it's a retrospective review. And what we notice is once patients start belzutifan, they have a drop in hemoglobin levels, but once they dose reduce, the hemoglobin levels, they tend to go up or at least stay steady. So we also explore the outcomes of those patients who do dose reduced. And in the 4 patients that experienced disease progression, they all were at 120 milligrams, and no progression occurred in the 15 patients that had dose reduction at any point. So our findings suggest that dose reduction might be an appealing approach to mitigate the side effects, especially anemia, and also it doesn't seem to impact disease control. Thank you so much.